Okay, so today we are going to be doing still technique for a neutral lumbar somatic dysfunction. A couple things before we begin, just on how the motion of the leg will induce motion in the lumbars. If we flex the leg up to 90 degrees, we are going to be creating some flexion in the lumbars, and we can use that to localize our segment. If we bring the knee into a deduction, we're going to be rotating all of the lumbars away from us. As we bring the leg into abduction, we're going to rotate the lumbars towards us. If we internally rotate the leg, we're going to be driving the innominate superiorly, which creates ipsilateral side bending. And as we bring the leg into external rotation, we're going to be driving the innominate inferiorly, thus creating contralateral side bending. So for our patient today, we have an L1 to L3 neutral, side bent right, rotated left. You're going to stand on the side of side bending for your patient, which is going to be your patient's right side. What I'm going to do is I'm going to monitor at the apex, so I'm going to be at L2 with my finger pads on the right transverse process and a little bit on the spinous process of L2. I'm going to flex up the patient's leg until I feel that I have engaged that L2 segment. So I'm going to feel a little bit of relaxation when I get there. Then what I'm going to do is I'm going to adduct the patient's leg to L3, which is going to rotate L3 to the left, thus rotating L2 to the right. Again, for still technique, I want to make sure I'm getting to the position of ease first in my setup. Then what I'm going to do is I'm going to want to side bend her right, so I'm going to internally rotate the leg until I feel that I have gotten to that right side bending position of ease. So now that I have the patient in her position of ease, I'm going to add a compressive force from the knee down the femur to her acetabulum and actually all the way up through all the fascias of the body to that lumbar segment. And I should be able to feel that in my monitoring hand underneath. Once I feel that there's adequate compression, I'm now going to bring her through her barrier. So to do that, what I'm going to do is I'm going to bring her leg into abduction, external rotation while maintaining my compression, and finish out the glide, and then I'm going to go in and reassess.